For this part of the show, what we do is we take questions from the audience, and today we have a question from Farrell.
Hi, my name is Farrell Tapscott. I'm from Middleburg, Virginia, and today my question for Dr. Wendy is, what do you do when you burn yourself in the kitchen?
That is an excellent question, actually, especially this time of the year, because around Thanksgiving time, around the holidays, people are definitely spending more time in the kitchen, cooking on the stove and using the oven to bake. So certainly there's more of a chance that someone can get a burn. And what happens if you do get a burn, the first thing you need to do is you want to remove any clothing that's around the burn, unless the clothing is actually stuck to the burn. In that case, you would not want to remove it. You'd want to take the person to the doctor. You also want to remove jewelry from around the area of the burn because the area may swell and then the jewelry may get stuck on the area. So once you've done that, then you need to immediately help the person to get to cool running water. You don't want to start using ice packs or ice water. Just cool running water in the sink or some sort of faucet for 10 to 15 seconds at least until the pain is starting to improve. And then once you've done that, then you need to assess, how serious is this burn? Because most minor burns can be treated in the house. So you want to take a look at the burn. There's 3 different kinds of burns, and I'm sure people have probably heard of these. The first degree burn, where you'll see some pinkness and swelling and pain. And then there's the second degree burn, which is 1 layer deeper than a first degree burn. So second degree burn does have the swelling and redness and pain, but it also has a blister. So that would be a second degree burn. I'm sure many people listening have probably had these. I know I have. And then a third degree burn really is an emergency. It is a burn where all the layers of the skin have been damaged, and it will actually look charred or dark brown, or sometimes it can look waxy and white, and that you need to take care of it immediately. So basically, once you've assessed what kind of burn it is, you need to figure out if you need to go to the doctor or not. If it's a large, deep burn, you should go to the doctor. Also, if it's an electrical burn or a chemical burn, the recommendations are also to go and see a physician. So you could go to the emergency room or an urgent care center. And if there's any burns on your face or on your hands or over areas of joints like elbows and wrists, the recommendation is also to get evaluated. So if it's a small burn and it's something that can be treated at home, what you need to do is you just gently wash it with soap and water. You don't have to scrub it. And if there's a blister, please do not pop the blister. It is very tempting, I know, but popping the blister increases your risk of infection. So you don't want to do that. And then what you need to do is put a little bit of either petroleum jelly on the wound, the burn, or you can put a little bit of aloe vera or some antibiotic ointment. I'm sure that many people growing up here, they should put butter on the wound or Crisco on the wound, but no, don't put butter or anything household item like that on the wound. What you need, and don't want to put other types of creams and lotions, and don't even put cortisone cream. Just what we mentioned, the antibiotic ointment or some aloe vera. And then some of the burns will need to be covered, and you want to do it loosely. You want to take a non-stick sterile dressing, not something that's a regular piece of gauze, because regular gauze has a lot of little fibers in it, and those fibers can get in the burn, and then it's really hard to take the gauze off when you're changing these bandages because they need to be changed every day. So you want to use a non-stick sterile dressing, loosely wrapping it, and then you do want to monitor for signs of infection. Obviously, if you see an increase in swelling or increase in pain, if you're having any fever, or if there's any oozing or pus, or if you see like a red streak coming from the burn, that's a sign you need to see a doctor immediately. And if you're having pain from the burn, you can use over-the-counter pain medicines. Tylenol, which is acetaminophen, is fine, or ibuprofen, which is the same thing as Advil or Motrin. Those would be fine. Minor burns can take about 3 weeks to get better. They do scar, and they itch. So if you have itching on the burn, it's actually a sign of healing. So it's not a bad thing if you have itching. And lastly, you might be surprised to hear that you might need a tetanus shot, because when you have a burn, it actually makes it more likely for a bacteria like tetanus to come along and infect the burn. So if you haven't had a tetanus shot in 5 years, you need a tetanus shot when you get a burn. So the best way to find out whether you need one or not is to call your regular doctor and ask. Or if you can't remember and you're pretty sure it's been more than 5 years, then you should get a tetanus shot. So that's really about it. Most burns can be taken care of at home, but if you have any of the situations that we were talking about, you really need to go and get evaluated immediately. So I hope everybody has safe time in the kitchen over the holidays, and we'll see you next time. If you have any questions that you'd like me to answer, please email programs@hctv.org with your question, or you can email a link to a video of you asking the question.